Hello, my today's topic is adverse drug reaction reporting. What is the adverse drug reaction? Adverse drug reaction is the any unintended untoward reaction occurs from the administration of the investigational medicinal product related to the dose or the treatment. It's called as adverse drug reaction. Adverse drug reaction is the any unintended and the nauseous reaction which have the causal relationship with that of the medicinal product. What is the unexpected adverse reaction? The unexpected adverse drug reaction is the reaction occurs which is not mentioned into the standard book or the investigational brochure of that particular medicinal product. When we talk about the reporting, the first question arises, who can report the adverse drug reaction? So anyone can report the adverse drug reaction, like the patient, his family, his relatives, his friends, patient, doctors, nurses, pharmacists, any healthcare professionals, and lawyer also can report the adverse drug reaction. Whom to report the adverse drug reaction? We can report the ADR to the regulatory authority, sponsor, pharmaceutical industry, and medical authorization holder. What are the mediums of the reporting the adverse drug reaction? There are the many mobile applications, many forms like the yellow card, blue card, adverse drug report. There are also websites of the regulatory authority, websites of the pharmaceutical industry. Toll free numbers are also present. All these mediums can be used to report the adverse drug reaction. There are the different forms specific to the specific country. For the India, there is the suspected adverse drug reaction reporting form is present. Then for the US, there is the MedWatch 3500A report, which is the mandatory report for the healthcare professional or the medical authorization holder. And US MedWatch 3500, uh, it's a report for the, which is the voluntary report for the healthcare professionals, and 3500B is for the consumer. There for the Australia, there is the blue card, and for the UK, there is the yellow card is present. And for Europe, there is the MEDRA. These are the different types of the reports are present to the specific country. There are the main two types of the adverse drug reaction report, that is the voluntary reporting and the mandatory reporting. Voluntary reporting is forwarded by the regulatory authority to the healthcare professionals. The specific country design and use their specific forms. The example of the voluntary reports is the MedWatch, that is the US MedWatch 3500 for the healthcare professionals, and the 3500B for the consumers. And for the India, there is the ADR form. And for another type is the mandatory reporting. Mandatory report also provided by the regulatory authority to the medical authorization holder. They should have to report the adverse drug reaction to their medicinal product marketed into the market. The example of that mandatory report is the US MedWatch 3500A, which is the mandatory report. Another types of the reporting is the solicited reporting, spontaneous reporting, literature, and the individual case safety reports. Let's talk about the let's talk about the what is the spontaneous reporting. Spontaneous reporting is the an unsolicited communication between the pharmaceutical industry regulatory authority, patient who describe the adverse drug reaction, which does not have the which does not have gathered the information from any study or any information collection scheme. It's called as the spontaneous reports. And the solicited report. Solicited report is the information of the adverse drug reaction, its description, which is obtained from the patient support programs and other patient support programs and the disease elimination or the direct to consumer act also. There is for the some companies to the specific companies, and literature abstract are also present. Then next is the individual case safety report. Individual case safety report also contain the organized and unorganized information, that is the solicited and unsolicited reports are there. For the organized, there is the non clinical trials, clinical trials, non-interventional patient reports, patient registers. These are some used for the solicited information, and for the unsolicited information there are the literature abstracts are present. Also there are the health authority reports present, the lawyers reports, uh, and there are the some social platforms, that is the Twitter and the Facebook, where the this adverse drug reaction can be uh, reported. Thank you.